At first glance, you'd never know that DeAnn Fylling is a breast cancer survivor. She's a fitness fanatic, a first sergeant in the North Dakota Army National Guard, and a saxophone player to boot. But this Bismarck resident has been through the ringer. A fast-growing cancer led her to opt for a double mastectomy and breast reconstruction through Sanford Health plastic surgery.
On my mammogram just 1 year prior, there was nothing. And so it had grown, and it had grown fast. Initially they thought it was stage 2, but when they did a biopsy of my lymph nodes, it had indeed gone into my lymph nodes, and so I had stage 3.
Doctors walked her through her options, including a unilateral mastectomy to remove only the affected breast, but Fylling chose a different route.
I have 3 girls. They're, at the time, they were 14, 10, and 6. And mostly just thinking about my kids, I just really wanted to give myself the best shot at longevity, and so I decided pretty quickly to go with a bilateral.
Fylling would have both breasts removed, but not before grueling rounds of chemotherapy. During that time, she had to decide whether or not to pursue breast reconstruction. She relied on the advice of her oncology team, including her breast surgeon, Dr. Jessie Dirksen from Sanford Health in Sioux Falls.
There's just a level of femininity that I wanted to maintain, and I never thought that I really cared that much about how my chest looked. I had considered just going flat and just having my breasts removed altogether. He encouraged me to look at photos and just see, what that looks like. He said there would be probably some concave on my chest, and he said, I don't know how comfortable you are with that.
Fylling chose to have breast reconstruction done at the same time as her mastectomy.
All of my team of doctors, especially the plastic surgeons, they've just been really supportive and kind of helping guide that decision. Well, knowing that at the end of the day, I had the autonomy to kind of choose what I wanted.
Following surgery, Fylling went in for more treatment, this time in the form of radiation. 4 months post-op, however, there was an infection on the other side of her body. She was treated close to home by Sanford Bismarck plastic and reconstructive surgeon, Dr. Andrew Mills.
The decision was made to proceed to the operating room to explore, remove the implant, obtain cultures, and first treat the infection. And we ended up doing 2 different washouts, and on the 3rd surgery, after the 3rd washout, we were able to go in and replace a new implant, but a similar type implant back in, and thankfully we were able to salvage the implant.
Since then, the two have stayed in touch.
Dr. Mills in particular has just been really, really patient with me. I was never looking for a breast augmentation, and it was just kind of what happened as a part of the cancer journey.
That's what Dr. Mills emphasizes most about the work he and his team do at Sanford Health.
At its core, plastic surgery is all about restoring form and function. A lot of women, every time they see themselves in the mirror, it's a stark reminder of the trauma, the cancer, chemo, radiation, everything they have gone through. So it's very rewarding to be in a situation where we can try to give them back what the cancer takes away. To be able to have that impact on patients, it's very, very rewarding.
In Bismarck, Jason Anschutz, Sanford Health News.